Welcome to Social Security Posts, where we break down what matters most for seniors and families living on fixed incomes. Today, we're going to look closely at some new rules changing how Medicaid works across America. These changes are a big deal, affecting millions of people. I know it can feel overwhelming and confusing when these laws change, but you are not alone. That's why we're here, to help you understand exactly what these changes mean, who they might impact, and what to watch out for over the next year. If you have any personal questions about how these rules might apply to you or someone you love, please leave them in the comments below. I read every comment and will reply to you personally to help you sort through the confusion. And before we jump in, be sure to subscribe and tap like so you never miss these important updates. Now let's dive into what you really need to know. Medicaid is one of the largest health programs in the country, serving about 72 million Americans. It provides health insurance for low-income individuals, children, seniors, and people with disabilities. This program has been a critical safety net for decades, covering doctor visits, hospital stays, prescriptions, and long-term care. Unlike private insurance or even Medicare, Medicaid adjusts its coverage depending on income and family circumstances, which is why any change to its rules creates a ripple effect for millions of people trying to stay healthy and financially secure. A new law recently passed in Congress, sometimes called the Big Beautiful Bill, is now signed into law, and it brings some serious rule changes for Medicaid. While not everyone enrolled will feel these new rules, a substantial number of people could see their requirements to stay eligible change. This is not speculation or rumor. These rules are official. And while it's normal to feel worried about something new, the best thing you can do right now is learn the facts so you know whether this affects you, someone in your family, or your neighbors. Let's break it down together. The new legislation was signed into law on July 4, 2025, and officially reshapes how certain people remain eligible for Medicaid coverage. Lawmakers passed it under a large package of federal budget changes, and this section specifically targets what they call work requirements. While this sounds intimidating, it's worth taking a breath and really understanding what that means in plain English. Essentially, the government wants a certain group of Medicaid recipients to perform work-like activities for a set number of hours in order to keep their benefits. This does not mean everyone on Medicaid will have to rush out and find a job, but for those who fall into a particular category, and we'll get into that shortly, the new rules will definitely change what they need to do to stay covered. The law is clear and signed, so this isn't something that might happen down the line. It's happening, period. As frustrating as that can feel, being informed now is your best shield against surprises. We're going to unpack exactly who is affected, what counts as meeting these requirements, and how to plan ahead. Out of the roughly 72 million Americans who rely on Medicaid, the new rules will likely apply to somewhere between 5 million and 20 million people. That estimate is wide because experts and reports still don't completely agree on the numbers, but everyone agrees it's going to affect a lot of people. The focus is on what's called able-bodied adults without dependents, basically adults who are considered physically capable of working and who do not have young children or other dependents in their household. These individuals will face the new requirements first. Seniors age 65 and older are completely exempt, which means they do not have to worry about fulfilling these work rules to keep their Medicaid. So if you are a senior or you have an aging loved one in your family, you can rest a little easier knowing that this rule does not apply to you. For everyone else in the target group, generally those between the ages of 18 and 64 without qualifying dependents, it is vital to stay on top of your state's announcements over the coming year because these changes will roll out in different places at different times. Let's take a closer look at exactly what work requirements means under this law. For those between the ages of 18 and 64 who are physically able to work and have no dependents, the new rule says they must complete at least 20 hours of work-like activity every week. That totals 80 hours per month. It might sound scary if you imagine working a job on top of caring for your health, but the good news is that the law counts more than just paid work. Activities like volunteering, community service, job training programs, or even attending certain educational classes will count toward meeting this rule. This flexible definition is important because many Medicaid enrollees have barriers to traditional employment, whether that's transportation, childcare, or even physical limitations. Allowing volunteering or education hours to count gives people more options to stay covered. But you cannot ignore these requirements if you are in the target group, because failing to meet them could put your Medicaid benefits at risk. That is why it is so important to learn which activities count, keep good records, and stay in touch with your caseworker as the rollout begins in your state. One of the most common worries people have is whether they personally will be forced to meet these requirements. If you have a disability, you do not have to fulfill the work rules, even if you are under age 65. The law clearly says that people with disabilities are exempt, recognizing that many are simply not able to maintain a work schedule. The same goes for pregnant women who will continue to qualify for Medicaid without jumping through these new hoops. Also, as we mentioned, seniors who are 65 years old or above will not have to do anything new. So if you're collecting Social Security and enrolled in Medicaid, rest easy. You do not have to worry about new work requirements interrupting your coverage. In other words, the law is focused on a specific slice of adults, younger, able-bodied, and without dependents. So if you fall outside of that category, you're protected. It is still smart to follow any letters or notices from your state so you know exactly what they expect, but these exemptions are built right into the new federal rules. Another big change under this law is how Medicaid defines a dependent. Previously, any child under 18 was considered a dependent, meaning a parent caring for that child would be exempt from work requirements. Now the definition has shifted, and only children aged 13 and under count as dependents. That means teenagers aged 14 and older will no longer protect a parent from the new work requirements. This is a huge change for many families. For example, if you are 42 years old, able-bodied, and caring for a 14-year-old, you would now have to meet the 20 hours per week work rule to keep your Medicaid. Previously, you would have been exempt. These details can feel unfair because a 14-year-old is obviously still a child in every other way, but the law now classifies them differently for Medicaid purposes. As strange as it seems, you need to remember this change and plan accordingly if you have teenagers in your household, so you do not risk losing your coverage. The federal law says these changes must be implemented no later than the end of 2026. That might sound far away, but in government time, it's actually quite soon. However, since Medicaid is run jointly by federal and state governments, each state will choose its own rollout timeline. For example, one state might adopt these rules within a couple of months, while another might wait until December 2026 to put them in place. The key point is that these changes will arrive in different states at different times, so you cannot assume your state will move slowly. It's very important to pay attention to state notices, news stories, or official letters about your Medicaid coverage. States are legally required to tell you when they begin enforcing these new rules, but it can be easy to miss a letter or email if you are not watching carefully. Stay proactive and make sure your contact information is current with your local Medicaid office. If you know about the timeline early, you will have more time to gather the documentation or find a qualifying activity so you do not accidentally lose your benefits. A lot of people wonder how a single federal law can be applied so differently from one state to another. It's because Medicaid, even though it is funded largely by the federal government, is administered by states. That means states oversee the day-to-day operations, enrollment, and paperwork. So when Congress passes a new law like these work requirements, they essentially hand it to each state and say, you have to do this by this deadline, but you decide how to run it. This setup means a family living in Florida might have to start following these new work rules in just a few months, while a family in Oregon might not see the rules enforced until much later. The same federal law applies to everyone, but each state controls when and how they begin. It can be frustrating to see the patchwork rollout, but it's how our Medicaid system has always worked. The best advice is to keep an eye on your own state's Medicaid announcement so you know exactly what to expect and when to expect it. If you or a loved one is enrolled in Medicaid and you fall under the category of an able-bodied adult between 18 and 64 with no dependents under 14, these work requirements are something you will need to track. Seniors, people with disabilities, and pregnant women are protected from these new rules. That's worth repeating. If you are 65 or older, you will not have to meet any new work requirements to stay on Medicaid. Take comfort in that, but still watch for official notices. We know these rules can be complicated, and with each state handling its rollout differently, it might feel stressful to keep track of what's going on. The best strategy is to check your mail, answer official phone calls, and keep contact with your Medicaid caseworker. Also, be sure to check reliable news sources or come back here to Social Security Post, where we will continue breaking down changes as they happen. Staying informed is your best tool to protect your health coverage. Thanks so much for watching Social Security Posts. If you have any questions at all about these new Medicaid work requirements, please drop them down in the comments. I promise to reply to you personally. And please tap the like button and subscribe so you never miss important updates that matter for your future. Take care, stay safe, and see you in the next video.